choice of painkillers. Which NSAID should I prescribe? The choice is very wide and depends not only on your individual preference, but also on the patient's response. Some patients respond to piroxicam, some find it ineffective, some respond to diclofenac while some do not get relief from it. So, if the patient does not respond to one drug, try another. For acute pain, the commonly used drugs are nimesulide, diclofenac, aceclofenac, and ibuprofen. Drugs available in the injectable form are diclofenac, piroxicam, and ketoprofen. For chronic pain, prefer slow-release preparations of diclofenac, piroxicam, nimesulide, and ibuprofen. The next choice is naproxen, flurbiprofen, indomethacin, mefenamic acid, etc. Before prescribing an NSAID, always ask 3 questions. Does the patient have peptic symptoms like epigastric burning, retrosternal or epigastric pain, regurgitation, etc.? Is he asthmatic? Is there a known allergy to NSAIDs in the past? Because many patients are sensitive to specific NSAIDs like ibuprofen or diclofenac, and they usually know it. If in addition, you need to combine a steroid, the patient must have no peptic symptoms. Check BP. There should be no hypertension. Rule out diabetes. Clinical problems. If the patient has peptic symptoms, choose the NSAID, which is the least gastric irritant, yet effective for the patient. Here is a list of NSAIDs in order of least gastric irritation. Nimesulide, meloxicam, nabumetone, valdecoxib, piroxicam, tenoxicam, diclofenac, aceclofenac, ketoprofen, flurbiprofen, indomethacin, mefenamic acid, ibuprofen, phenylbutazone, oxyfenbutazone. To be avoided. Never combine 2 NSAIDs or an NSAID and a steroid. Combine a smaller dose of NSAID with a larger dose of plain analgesics, which do not irritate the gastric mucosa. Example, paracetamol, dextropropoxyphene, tramadol, ketorolac, etc. The addiction-forming analgesics like pentazocin, Fortwin, buprenorphine, pethidine, etc. should be strictly avoided in chronic painful conditions. Give strict instructions. Drugs must be taken after food or milk, never on empty stomach. Stop the drugs immediately. If epigastric pain, burning, or vomiting, always co-prescribe antacid and ranitidine or omeprazole. Prefer more doses of local application. Example, Voverin Imugel, Herox gel, Brufen gel, etc. or Rofnid skin patch, ketoprofen. Prefer injectable drugs to avoid gastric irritation, especially in an acute phase. However, remember that gastritis or ulcer perforation can occur even when NSAID is given in the injectable form. Diclofenac, piroxicam, and ketoprofen can be given in injectable form. If the patient has asthma, avoid aspirin, ibuprofen, diclofenac, mefenamic acid, and piroxicam. If necessary, these drugs may be given with caution, under observation, as bronchospasm is induced in only 10% of asthmatics. Not all, 90% can take these drugs. Give nimesulide, meloxicam, valdecoxib, celecoxib, selective COX-2 inhibitors, analgesics like ketorolac, dextropropoxyphene, or tramadol. If the patient is pregnant, avoid all NSAIDs in early pregnancy. Give only aspirin or paracetamol. If the patient has a significant hepatic impairment, avoid all NSAIDs. Give only aspirin or paracetamol.